Okay, if you've ever had a strain or a tweak in your lower back or your SI area, or you think that your SI joint is out of place, then there are two muscles that you can work on and do some soft tissue stuff. The first is the quadratus lumborum, and the second is the glute medius. And this is not like a catch-all, this is not like something that's going to help in all situations, but it may help your current situation, help alleviate pain in that area. So the first, the quadratus lumborum attaches on the bottom rib and the transverse process of every vertebral segment in the lumbar spine, and then goes down and attaches on the crest of the ilium. So that's the iliac crest. So we're gonna use the Theracane to hit this, and this I'm kind of pulling some of this stuff from the trigger point Theracane, adjusting how we're gonna hit these muscles. So Leah's gonna help us. So the way that you can know where your quadratus lumborum is when you lay on the ground. It's easier when you're laying down, and you hike your hip up, like you're trying to pull this side of your hip up to your shoulder, and you can feel it contract back here. You can just go ahead and palpate around, and whatever you feel contract, that's the QL. So it's easier to use with this than a lacrosse ball, but I'll show you how lacrosse ball in a second. You basically find out where it's contracting, and you've got kind of more medial fibers closer to the spine and more lateral fibers. The best way to hit the medial fibers is to get this this Theracane up under there, and then use the ground as a lever, and then it's almost like a little rowing motion, like you're just going down a stream. But you want to think about ironing out these little tight areas, or trigger points as the book calls them. You want to think about ironing them out in one direction. So 10 to 12 rowboats here, and then if you're real sensitive, more lateral, like closer to the to your side out here as opposed to closer to the spine, then you can kind of stick the Theracane in there and then just work it with both hands and stroke in one direction. You can, it doesn't hit it as well, but you can take the lacrosse ball and kind of lay on it on your side, and you're not going to be able to see, but I'm essentially, in this case, putting the lacrosse ball right here and stroking kind of in a similar way, but it's a larger area than the Theracane, but I'm actually hitting the QL pretty good in this particular position. So that's the quadratus lumborum. You'd want to work on that several times throughout the day, as is the case with doing soft tissue work. So the glute medius is a muscle that attaches like underneath that iliac crest on the outside, and then goes down to the greater trochanter or the hip. And so every time you take a step with your opposite foot, the glute medius on the opposite side of the stepping foot is holding the entire body weight in place and preventing the hip from oscillating around. So when because of the weird angle, or the lever of that particular muscle, it's handling like 2 times the weight of your body. So that's a lot of force to be applied on there. So if you're adding a load, just in any kind of loaded movement or rucking or something, then you're going to start irritating it. If you're running and lifting, you can irritate this muscle pretty easily. So it's easy to see how we could have issues with this. And so the reason these affect the SI area and the pelvis is because they're just pulling tension on various parts of the pelvis or the SI itself, and that's what's creating the pain and tension. So glute medius, you can take Theracane, whatever kind of soft tissue thing you have, the lacrosse ball works fine. And you can find where it is by finding your hip bone, and then kind of going lateral and kind of inferior to that, which means lower. And then when you step back and forth and just take your weight to each foot, you can feel it contract. Don't be confused by the TFL, which is out here, kind of more anterior out front, where these 2 fingers are. That's the TFL, and that's a different muscle, which is probably good to work on, but we're focusing on the glute medius right here. So you can stroke in one direction along that, and then you can also feel it if you touch where the head of your femur is, and go a little bit above that, and you can kind of feel the glute medius contract there. So you can work on both of those areas to help alleviate tension on the pelvis itself, which should help that whole area in your lower back. That if you ever have any kind of tweaks down there, start working on these things to loosen them up. And then if you have tightness on a regular basis in your lower back, try hitting these up as well. And also the glute minimus is something that helps the glute medius do its function. So if you have a wallet in your back pocket and you're normally sitting on it throughout the day, whether you're at work or you're driving, then go ahead and take that out and just, you know, put a coffee cup, or not in a coffee cup. The fucking, you know, a little thing in your car that you fucking put, alright, we'll see you next time.